Okay, good morning, everyone. Thank you for joining on a Sunday morning. We have a wonderful presentation for the Holistic Health Alliance's monthly talk by Dr. Suraja Roy Chowdhury. She'll be talking about uh, acupuncture and pain management, and there are many other, interesting information about this form of medicine. So before she takes over, I would like to just quickly go through our Holistic Health Alliance's just a mission. We just finished our 10-year anniversary. We have been around for 10 years and doing great work in promoting health and well-being in the community. Holistic Health Alliance is a nonprofit organization, and basically we educate the community for about different forms of modalities of health and wellness. And we encourage people to take care of their health in their own hands, take control of your well-being as well. And we also have a membership program. We have practitioner members, we have volunteers who can join our community, and we have our amazing projects run by youth called the Youth Brigade. So members can join as practitioner members, and they get to, give informational talk like Suraja is doing today. And Youth Brigade members, they work on a couple of projects like Teen Mental Health Initiative, and they do also another project called Fooditude. So basically, Holistic Health Alliance in a nutshell is about empowering all the community members about taking care of their own health and well-being. You are in charge of it. So there are different varieties in simple and more elegant and more ways to take care of your health and well-being. So this is a great platform, and I'm proud to be part of it. I'm a volunteer for this platform, and I work closely with Pratibhaji, and she's not here today, but hopefully she'll join next time, and next time you can, join her talks as well. So without any further ado, I will stop my screen share, and I will let Suraja take over. All right, is it gone? Okay, Suraja, you can share.
Can you see it now?
Yes.
Yeah. Okay, great. So thank you very much, Anjana, and thank you to Pratibha too for inviting me to give this talk. My association with Holistic Health Alliance is very old. I've been there I was part of the beginning. I was actually the Massachusetts chapter chair for the Holistic Health Alliance for a couple of years in 2015 or 2014. I don't remember when. But it was very interesting. We were right at the beginning, and getting all our outreach processes in place and stuff like that. And then I got busy with work, so I spun off. But it's a very wonderful platform, and definitely does a lot of great work in outreach to the community. Just a little background about myself. My name obviously is Suraja Roy Chowdhury. I am an acupuncturist and Chinese medicine practitioner currently. My previous background, I have a PhD in pharmacology, and I used to work in the pharmaceutical industry with drug development, mostly in psychiatric conditions such as depression, anxiety, schizophrenia, sleep, things like that, before I moved to this career, which I have now been in practice for the last 10 years. So this talk that I planned today was actually a variation on a talk that I gave to the Asia American Psychiatric Association a couple of years ago. So they also wanted to talk about stress and pain management using acupuncture or acupressure. So I thought that was perfect because it's something that everyone in the community really resonates with. everyone is stressed out and a lot of people are in pain. So I thought, this is a great topic for us to talk about. So that's the way I've planned this lecture is, first of all, just give you an overview of what is acupuncture and what is Oriental medicine really. What is Chinese medicine? What are its philosophies and principles? And then how do we, from the Chinese medicine lens, how do we look at stress? How do we look at pain? And then how do we treat? So this is how I thought I would structure this talk. And anytime any of you have questions or anything like that from my side, it's okay for you to interrupt me and ask. I don't know how Anjana wants to do it, whether you want to have the questions at the end, but either way is fine with me. Okay.
We'll have the questions in the end after the
In
presentation.
the end? Okay. All right. So I take it back. Questions at the end. Okay. So Chinese medicine is a very ancient form of medicine. It is the oldest textbook that we have right now. It's called the Huangdi Neijing, or the Yellow Emperor's Inner Classic. And it is from 330 BC. And even at that time, so it's like 2,500 years old, and even at that time, it was a compilation of all the knowledge that existed at the time. So the medicine is really much, much older than what we think it is. But historically, it has been around for about 2,500 years. So this is just a cartoon depicting, that here's a woolly mammoth, which as we know now is extinct. And it was probably being chased by hunter-gatherers, and, somebody threw needle arrows or spears at its butt and on its legs, and suddenly the neck feels better. And that's pretty much how people who have pain in acupuncture, we treat them. If you have a pain in your neck, we don't necessarily put needles in your neck. And then people are like, wow, how did this even happen? So this is just a comic representation to show that Chinese medicine, the concepts of Chinese medicine, the concepts of acupuncture are very old. So it's called Traditional Chinese Medicine, or TCM. And it's an ancient, natural, comprehensive system of healing with a continuous clinical history of about 3,000 years. Now, this system of medicine is used extensively even now in China. It is one of their mainstream medicines. And in fact, I've been told that when you go to a hospital, you will have, the regular Western medicine wings, and you'll have the wings that that have Chinese medicine. And you can go to the pharmacy and you can pick up your tablets and you can pick up your bag of herbs. And the two coexist peacefully, beautifully together. And now Chinese medicine, and particularly acupuncture, is becoming more popular even in the West. And in fact, in the US, it is a regulated form of medicine. So we have to actually take board exams. First of all, it's a 3.5-year master's program. And now you can do a PhD as well if you like. And then you have to be licensed. You have to take boards. And then you have to be licensed by the American Board of Internal Medicine, which has a branch for acupuncture. So unless you're a licensed practitioner, you cannot practice in the United States using acupuncture, which is a very interesting thing because, it's becoming more and more mainstream now. So what are the components of Oriental medicine? Oriental medicine is not just acupuncture. And like every ancient medical modality, it is a construct of many different things. So number one is food. Food as medicine is a very basic concept in all, in Chinese medicine, in Ayurveda, in all ancient forms of medicine. So there's diet therapy. Then, of course, there's herbal medicine, which is very widely used because herbs are always easily, available everywhere, as opposed to somebody who can do acupuncture. And then there's acupuncture. Then there is body work, or what we call tuina. And then there is exercise, which encompasses Tai Chi and Qigong. So all of these branches together constitute Chinese medicine or Oriental medicine. And we're going to talk in detail about acupuncture, but I just wanted to give you a little bit about Chinese herbal medicine and body work. So herbal medicine, contrary to the word herb, it's not just plant-based. Majority of the things we use are plant-based, but then there are also animal-based and mineral-based products. There are about 400 commonly used herbs. Each herb has specific properties and functions. And when we create a Chinese herbal medicine formula for a patient, it's always customized to the patient. And it is never one single herb. It is always a combination of herbs that will treat the patient's symptoms and that will also mitigate the side effects if any of those, if the primary herbs that treat the symptoms and if something is added on so that it makes it more palatable. Because sometimes these herbs are how do I say it? Not the most delicious things on this planet. So, they add a little bit of, say, licorice or something to make it more palatable and also more, easy on the digestion. And then there's Chinese therapeutic massage or body work. We call it Tuina. And actually, in the Boston area, we are lucky because there are actually practitioners available who will do Tuina. There's like a nice place in Waltham called Oriental Foot Reflexology. They do Tuina. So Tuina basically is a form of massage that goes along the acupuncture channels, which I'll be talking about. And they use various different techniques, and they can focus on whatever your issues are, or they can give you a general body massage. So it's very interesting. And then, of course, Qigong and Tai Chi, these are forms of exercise, which also are exercises that we call that cultivate the Qi. So Qi is your energy in the body. And at all times, we want to make sure that Qi is flowing, Qi is healthy, so that we are in a state of good health. The benefits of Chinese medicine, it's a holistic system. So it focuses on restoring and maintaining the balance of energy in the whole body. And we like to say that we treat the root cause of the disease. So we don't just treat the symptom that you come with. So if you come to me and say, I have a headache, I don't just treat the headache. I try to figure out why you have the headache, which organ system is contributing to your headache. And then try to treat the root. And once we treat the root cause, a lot of issues, including your primary symptom, might get resolved. So, you may not be having a problem. You may think that you're not having a problem with sleep. You're getting by with 4 hours of sleep, but suddenly if you're balanced, you can start sleeping better. Your bowels can start feeling better. Your mood improves. So treating the root cause always improves a person holistically. We use unique diagnostic and treatment techniques. Obviously, a medicine that is like hundreds, thousands of years old. We are not using X-rays and CT scans and MRIs and things like that. We use, listening. So listening to a patient. So when they come in, they tell you what their symptoms are. And you listen in very carefully to everything that they're telling you about their symptoms. But at the same time, you're also listening to the tone of their voice. Is it a sad voice? Is it a breathy voice? Is it a whining voice? Is there a sing-song quality to the voice? So the nature of the tone of the voice also tells us something. Then we observe the patient. So when you look at the patient, how do they look like? What is their complexion like? What are their, the eyes like? What is their, how are they interacting with you? Like some people will look you in the eye and talk to you. Some people will not look at you. They look somewhere else and then they'll talk, or, and you feel like you're not making a connection with them. Then we look at the tongue and we look at the pulse. The tongue tells us a lot of different things about the person. So we look at the color of the tongue, the shape of the tongue, the size of the tongue, the coating on the tongue, the color of the coating, whether the tongue is swollen, whether the tongue is thin, whether the person can extend the tongue out, whether the tongue is pointed. So many things that you can look at you can get a sense of just by looking at the tongue. And then we look at the pulse on each hand, on each wrist, and different characteristics of the pulse will give us indications of what is going on with this person. And then once we have a diagnosis based on all of this, we then decide on how to treat the person. And of course, treatment is also multi-pronged. We give advice on diet, we give advice on lifestyle. But primarily, in my clinic, it is using acupuncture and using herbal medicine as an adjunct. And there are many other adjunct therapies that we use called moxa, cupping, tuina, many things like that. The advantage of this medicine is that the side effects are very minimal. So with acupuncture, you can get, the absolute worst thing that happens extremely rarely is that you can get a needle into the lung. And you can have, so when you're putting needles into the chest wall or in the back, you have to be careful that you don't needle deeply, because then you can puncture the lung. But this is drummed into every acupuncture student's head so much, and we do such good practice that it happens like maybe 1 in 1 million times. It is very, 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 very rare. The most common thing that happens is you might have a little bit of bruising, you might have a drop of blood or so, but pretty much nothing, nothing beyond that. And in the herbal medicine, you can have all the usual symptoms. Like you can have a little bit of GI distress, maybe you don't like the taste. But generally speaking, because they're very balanced formulas, you don't, the people tolerate them pretty well. And the whole emphasis on Chinese medicine is on prevention instead of treatment. So they say that in the olden days in China, every village would have a doctor, and the doctor's job was to make sure that the village was healthy. And in case there was an epidemic or something like that, people would catch that doctor and beat him up, because he should have prevented this thing from happening. So apparently, a lot of doctors would run away if there's an epidemic, because they would be afraid of their lives. So the emphasis is on prevention, and prevention through diet, prevention through exercise, prevention through mindfulness, and all of those things. And it has a long history of successful treatment for physical, mental, and emotional disorders. So it's been around. It's an official treatment strategy for in China and now in the United States as well. So what exactly is acupuncture? Acupuncture is the insertion of needles in specific points on the body. So these points where we insert the needles, we don't just insert them randomly into places. We put them into areas that are on what we call the acupuncture meridians. And the understanding is that when we put the needles into these points, we somehow unlock the movement of energy in the body. The energy in Chinese medicine is called qi. And qi is the energy that pervades the entire universe. So as you can imagine, as a living being, we are in equilibrium with the universe. So the energy in our body is in equilibrium with the universe. And when that equilibrium is disturbed is when you have illnesses. So by trying to move this energy in the body and not keep it stuck and thereby disrupting the balance, we are able to make the body actually feel itself. So it is a very, very powerful concept if you think about it, that because these needles, they don't have any medication on them, we are not injecting anything, nothing, we're just inserting them into the body. And just by inserting them, somehow the body is able to heal it, which means that the body has the ability to understand, has the ability, the capability to heal itself, which is a very, very powerful power. So, so qi, like I said, is what exactly is qi? It is the energy that permeates all things. It has to be able to flow freely to the body in order for a person to maintain overall health. And qi flows along the meridians of the body. Look, I'm going to tell you about it. So these are, this is a diagrammatic representation of the meridians. And, you can see that they're very specific. These meridians do not correspond to blood vessels or nerves or anything. They are separate entities in themselves. Now, with modern medicine, we have not been able to actually show the physical existence of these meridians. So it's not like there's a tube or a pipe or anything like that, or a line that suggests that these are meridians. But functionally, it has been shown that, you put in a needle in a particular spot, and down that line of that meridian that has been described by the ancient Chinese, you can see changes. So at the moment, we call them functional, they're functional lines that correspond to meridians in the body. There are 14 meridians. We have 360 regular acupuncture points along these meridians. And there are several what we call extra points, which don't fall exactly on the meridians, but they are around other areas of the body. And, treating these or injecting these, or, inserting needles into them, or doing acupressure on these points, you're able to influence the physiology of the body. It's very, very, very fascinating. So, just to continue that thought, how does acupuncture work? It promotes the smooth flow of qi, as we said. That is from a Chinese perspective. From a Western perspective, the way we understand it today, people say, but what do you mean by qi? What is it? What is flowing? So what we've seen is when you put in a needle into the body, to various parts of the body, you alter chemicals in the body, including you can cause release of endorphins. I'm sure all of you are aware of what endorphins are. They are the feel-good hormones that are released in the body, which are they are the endogenous morphine of the body. So they make you feel good. They reduce pain. They improve relaxation. All of those things. And acupuncture can actually stimulate the release of endorphins. It can modulate the activities of nerves, both locally. So, we don't put needles into the nerves, because if you put a needle into a nerve, you will get a shock. It is not a pleasant sensation. And those of you who have had acupuncture, you know that, it is not, acupuncture is not unpleasant. Like, you don't get an electric shock. You just get, a little bit of a sensation of heat or some dull ache, or sometimes nothing. But it modulates the activities of nerves, both in the region where you put the needle and, further away from it, which is also very interesting. It affects the body's natural electromagnetic fields. So all of us have electric fields in our body. Like, every cell in our body has an electric field. And as a whole, every human being or every living creature has an electric field around them. And acupuncture has been shown to modulate that electromagnetic field. It's been shown to regulate immune function. So a lot of the cells that belong to the immune system in the body have been shown to be affected by acupuncture. So, it basically improves your immunity, and it can, in a sentence, it can harmonize our body. And how, once you're in good health, you improve your capacity for enjoyment, for fulfillment, for happiness. So, in many ways, it affects, by affecting the physical nature of our body, it improves the emotional nature of our emotional state of our body as well. So these are just a little bit of this thing to show, detail to show you what these channels are. So there are everything in nature consists of yin and yang. This is a concept of Chinese medicine, which I'm sure everyone is aware of. So yin and yang are two opposing forces in the universe. Yin is the substance, the solid stuff, that the stuff that is made up of the universe is made up of, that is yin. And the qualities of yin are, it is solid, it is substantial, it is dark, it is heavy. And then there's yang, which is energy, pure energy, light, movement. So there's always a balance, a dynamic balance between yin and yang in the body. And so, like all things, there are yin channels on the body and there are yang channels on the body. And on the arm, there are 6 yin channels. Well, there are 6. There are 6 yin channels in total. 3 on the hands, arms, and 3 on the legs. And there are 6 yang channels, 3 on the arms and 3 on the legs. So everything that you see in the front like this, these are all yin. And everything you see on the back, these are all yang. So the back of the arm, or, these are yang channels, these are yang channels, these are all yin channels. So, channels of the hand that go to the head, channels of the leg that go. So we understand all of these channels, and, each of these channels has a function. They have specific acupuncture points. Each of the acupuncture points have functions. And when we create what we call a point prescription to treat a person, it is by knowing what is the combination of these points to use that we start treating a person. And then we also have a very important concept of 2 extraordinary channels, we call it. The Renmai, which runs in the middle of the body in the front, and the Dumai, which runs in the back, along the spine. And the energy cycles between the Ren and the Du in what we call a microcirculation. And when you're meditating, when you're doing Qigong, we meditate on this energy that starts in the groin, moves up to the top of the head, and then, flows down. So this cycle of energy, when you meditate on it, you can actually, I guess this also corresponds to a lot of the yoga meditation and, where you're trying to raise awareness. So, and then, so these are the six channels, the 14 channels, and each of the channels is associated with an organ. So there's lung, pericardium, heart, spleen, liver, kidney, small intestine, large intestine. Then we have a concept called triple warmer in Chinese medicine, which has only recently started coming into being understood in Western medicine, and we call it the interstitium in Western medicine. And then there's bladder, the stomach, and gallbladder. So these are all the channels that are associated with these organs. And then we also have the organs themselves, and they are associated with the five elements. So as you can see, this is a very complex system. So because there is an interplay with the universe, we always we assign properties to the organs. So, and what are the five elements in Chinese medicine? They are fire, earth, metal, water, and wood. And the organs that are associated with fire are the heart, the pericardium, the small intestine. The earth is the central organ, which is responsible for digestion. Then we have metal, which is lung, and the large intestine, kidneys, which is water, and kidneys, water, which is kidney and bladder, and then wood, which is liver and gallbladder. And each of these organs are also associated with a season. So earth is the summer, metal actually is right now fall. Water is winter, so that's coming up. Wood is the spring, when things are rising, things are growing, there's a restlessness. So the energy at all of these different times of the year are different. And the organs corresponding to them, they will resonate more in each of those seasons. So if you think about it in the fall, this is a season where people, the lungs are active, people are falling sick with colds and coughs, and, the lungs are affected. In the winter, it's going to become dark, it's going to be cold, and, you will have issues with the kidneys where you have, excessive urination, things like that. So that's being very, very simplistic, but that's just to get a sense of how beautifully this medicine is integrated with the larger universe. We are just specks in the universe. We have to be in equilibrium for us to be able to operate. So we are these individual, divine bodies which does not have any connection with what's around us. So a quick this thing on what the quick update and quick review of what these different organs do. So we have the five yin organs, which are the heart, lungs, spleen, liver, and kidney. The heart governs blood, influences mental activities, consciousness, emotional well-being. The lung controls respiration, of course. It also regulates the skin and it supports the immune system. The spleen we consider to be an organ of digestion in Chinese medicine. We now know in Western medicine that the spleen is actually an immune organ. It's not an organ for digestion, but in the old days, when they did the dissection, they would find the stomach and the spleen to be very close together. They assumed that those were organs of digestion. So we have to think about this more conceptually rather than the organ spleen. But the function of the spleen organ in terms of digestion is it transforms the food into energy and into blood, and it takes care of all, how the muscles work. It supports your mental clarity. The liver stores the blood, ensures that the movement of qi is smooth throughout the body. And kidney stores what we call our essence. So we are born with the essence of being human, and the kidney stores that. And we can think about it, I suppose, as hormones or something like that. And essence is something that declines as we age. And finally, when you lose it, you die. So but it's also responsible for water metabolism, bone health, and all of these. So all of these organs have their biologic functions, and then these are all the yang organs. So the yin organs are all hollow. The solid, the yang organs are all hollow. So the small intestine, large intestine, stomach, gallbladder, bladder, and the triple warmer. These are all hollow organs, and they are all involved in digestion and urination and excretion. Now, there's a very interesting concept. In Chinese medicine, we don't believe that physical and emotional issues are separate. So every organ actually has an emotion that is associated with it. So if you think about it, there is never a situation where you're feeling very this separation of mind and body is actually attributed to the French philosopher René Descartes, where he said I think, therefore I am. So, the mind and the body are two different things. But we don't believe that in Chinese medicine. And if you think about it, you would never have a situation where you have some kind of an emotional problem and your body is not affected. If you're depressed, maybe you're not sleeping well, or maybe you're sleeping too much. Maybe you're not eating enough, or maybe you're eating too much. Maybe you're having diarrhea because of the stress. So there's never a situation where you have a feeling, but your body is working perfectly fine. It just doesn't happen. There's always a physical symptom associated with it, with emotions. So how do we address emotions in Chinese medicine? So the organs of the body are associated with various emotions. Grief is held in the lung. So if you think about it, a person who's very sad, they'll be hunched up, they're sort of protecting their lungs like that. You'll find them taking, sighing, things like that. Joy is housed in the heart. So when you're happy, you feel your heart is exploding with happiness, and it's very you feel great. Everything feels centered in your chest. But again, each of these, so these are the biological functions, and these are all the good things. But the bad, joy, too much of joy is also not good, because that becomes mania. So mania then becomes somebody comes with mania, then we think, oh, okay, the heart is, involved in whatever the pathology that this person is exhibiting. Anger is housed in the liver. So people who have, if you think about it, the flow of energy, I told you that liver is the organ that is responsible for the movement of energy. So if energy is not moving, say you're stuck in traffic, let's take the traffic analogy. Traffic is moving, you're happy. Traffic stops, you get annoyed, and there are people who get really irritated and they'll yell and they'll show you the finger, and those people are liver people. The liver is not, the liver is getting activated with that sort of anger. Fear is housed in the kidneys. So if somebody is very afraid or they get a sudden shock, people pee, they lose control of their bladder. So fear is housed in the kidneys. So when somebody has had a big shock, they will, when they tell you about it, we take into consideration that maybe we need to treat their kidneys, something has been happening there. Or as you start aging, I told you that we have the essence that's stored in the kidney that starts depleting. So you want to treat the kidneys in order to shore up the kidney efficiency, so that the processes of aging they become more palatable, shall we say. And worry is housed in the spleen. So remember, spleen is the central organ for digestion in Chinese medicine. So when you're very worried, your stomach feels upset, like you have to go to the bathroom multiple times, there's rumbling in your stomach. So all those kinds of things you feel when you're worried. So this is the association of emotions with the different organs in Chinese medicine. So there's never a separation. There's always a physical function. There's always an emotional function. The two go hand in hand. So when we can identify based on what the patient tells us, what their pulse tells us, what their tongue tells us, then we can get a sense of which organ is affected. So even in terms of their, I told you when they're listening to what they're saying, the tone of their voice, also tells us something. So a person who is, sometimes people have a very, when they're talking, you can hear there's a laughter in their voice, the voice sounds happy and joyous. Those people, we say, oh, maybe this person is has a heart constitution. Or there are some people who are very loud, they'll talk and then the whole room, like, that's their normal way of talking, very loud. So we say maybe they are liver people. Or there are people who they talk very softly, like they whisper and, they sound very sad. So those we say maybe their lung, we should check their lung. Or people, sometimes people have a groaning tone to their voice. They'll talk like that. And, they have somewhat of a deeper voice, more of an undertone. And we say maybe that's a kidney voice. So, or some people who are like, they're like just chattering and, very worried, and the whole topic is all about concerns and this and that. Maybe it's the spleen that's involved. So, all of this, so it's a multi-pronged approach to looking at to diagnosing a person. Understanding the physiology is obviously very, very important. And, like I mentioned earlier, but just to reiterate this, Chinese medicine efficacy in 1997, which is now, so many years, like what is it, like 50 years ago, NIH had said that, acupuncture is effective in the treatment of all of these symptoms: nausea, dental pain, addictions, asthma, arthritis, menstrual cramps, pain, carpal tunnel, a whole host of things. And now, like, there are a lot of more and more, there's like evidence-based medicine that supports the use of acupuncture with, chronic pain conditions, migraines, post-operative nausea and vomiting, even in cancer-related nausea and vomiting and fatigue. So, in fact, a lot of the big cancer hospitals in the US, like Dana-Farber, Sloan Kettering, they all have acupuncturists on staff to treat patients while they're getting chemotherapy, so that you can minimize the effects of chemo. Menopausal symptoms. So all of these symptoms, they are all of these illnesses are now treated very well with Chinese medicine. And to be very honest, like, a lot of people will, they come to you with all kinds of various symptoms, and we don't look for the name of the symptom. We are not saying, okay, headache, we're going to treat like this, because headache can be, many people can have headache in the front, people can have headache on the side, they can have headache on the top, they can have headache on the bottom, on the back, they can have one-sided headaches. With their headache, they are able to sleep, not be. So the whole constellation of symptoms that a person comes with is what we look at, and then we treat. So having a Western diagnosis may help, but it doesn't really matter in the way that we address our treatments. I hope that's making sense. So what happens at an acupuncture? So you come in, the person comes in, and generally speaking, in the West, people are coming for chronic conditions, because they're not, nobody comes to an acupuncturist as soon as they have a problem here. First, you go to Western medicine, then, something doesn't work, or you're not happy with the treatment, or your symptoms are still lingering. And then you say, "Okay, now what should I do? Okay, let me, my friend said, let me try acupuncture." So they come to you. And so what we do is we take a very in-depth history. So, like I said, diagnosis consists of listening to the person, observation, palpation, pulse, tongue diagnosis, all of these things. They talk to us for about half an hour or so. I take a good long history. And then, based on what the person tells me, I say, okay, so maybe the liver is involved, maybe the kidney is involved. Now, what points should I use? And then, you draw onto the knowledge you have of all the various acupuncture points. And I'll be very honest, all 360 points, I don't know what they all do. I don't remember what they all do. But there are several very, very commonly used points, maybe about 70, 80 points that we know about, that we can use various combinations. So we decide, like, what is the point prescription for this person. And then we'll insert the needles, and then the person rests for about half an hour. And then might add on additional therapies, like, I might do like ear acupuncture, I might do a little bit of tuina, I might do a little bit of cupping, I might decide to give them some herbal formulas. So all of this happens during the treatment, when a person comes for an acupuncture treatment. And then the first question, of course, everybody asks is, "Oh my God, Surya, does acupuncture hurt? I've heard it hurts." And then, you have to tell them that, look, so this is a comparison of the size of the needles. So this is a matchstick. This is a medical syringe. And as you can see, a medical syringe, of course, is hollow, because it is meant for withdrawing blood or withdrawing tissue. An acupuncture needle is actually solid. So we call them filiform needles. So when you insert the needle, you don't actually cut through the tissue. You're not going, taking a little bit of sample out. The needle that's finding its way between all the various fibers in the body, the muscle, areas. And as you can see, when the comparison, the acupuncture needle is a very fine needle. So those of you who have had acupuncture, you know that it doesn't really hurt. You might feel a little bit of a sting when the needle goes in. And then once the needle goes in, you can feel a dull ache, you can feel a warm, or you can actually feel nothing. Sometimes I have patients who, of course, there are those, pain is always a subjective thing. So when inserting needles, sometimes people will be very reactive. Very few people, luckily, are, very fussy about needles, but the majority of the people find them very relaxing. So once the needles are in, they rest for half an hour and then, they're done. So, yeah, and the various treatment strategies, just, there's channel theory, like how do I decide how to treat a person? So there are for something that's 3,000 years old, there are very many ways you can treat a patient. There are very many ways, theories that you can draw upon to treat a person. So there's channel theory, there's many styles of acupuncture, there's Japanese style, there's Chinese style, there's Master Tong style, many styles of acupuncture. And we get exposed to a lot of this during school. And then after that, every 2 years, we have to renew our licenses. We need continuing education. So I take, most people will have to take a lot of different classes. So you expand on your knowledge, and it is an real infinite knowledge base. You can just keep learning, and you always feel at all times that, oh my God, there's so much more to learn. So there's just different ways of looking. You check the tongue pulse, look for a pattern, and then decide what channels to treat, which way you want to treat, and you go ahead and treat. And same thing for herbal medicine. What herbs do you want, and which formulas you want to use. What are the properties of the herbs? Like if a person is showing many symptoms of cold, then we want to use herbs that are warm so that you can treat that condition, and things like that. So moving on to the stress and pain part of our talk. What is stress? So stress, how do we define stress in Chinese medicine? So we say stress is caused by overstimulation of the 7 emotions, which are joy, thinking, anxiety, sorrow, fear, fright, anger. So overstimulation of any of these emotions can then damage the associated organs. So like I told you, these are all the organs that are associated with the various emotions. When the organs are damaged, then you can have obviously they all have a function with the movement of energy, the creation of energy, the transformation of energy. So you'll have a disturbance in chi and blood. And when you have stagnation of the chi, so chi is not moving, if you think about it, you can have like some machine that, that's stuck, it is creating heat. So we say there's chi stagnation turns to heat. Chi is what powers the movement of blood. So if chi is stagnated, blood is not going to move. You get blood stasis and, all of these associated concepts that we have called phlegm and damp and all of that in this medicine. And some of the ways that stress manifests, say if you have this combination of symptoms, palpitations, racing mind, difficulty falling asleep, constipation, you look at their tongue, the tongue has a red tip, and we say, oh, maybe this person has, heat in the heart, heat fire. Or if you have, this constellation of symptoms, anger outbursts, dream disturbed sleep, you're very irritable, stress and anxiety, then we say, okay, anger is, remember, related to the liver. So they say maybe there's energies on moving through the liver. Or you can have these kind of symptoms, which are, more sort of more serious kind of symptoms like mental confusion, lack of clarity in thinking, palpitations, restlessness, uncontrollable laughter. Remember what I said about mania being pathology versus physiology of joy. So you can consider that, there's some association with the heart. We can say maybe there's heart phlegm in this person. So these are different patterns that we think, heat leading to liver chi stagnation. So you can have poor appetite, depression, irritability, fatigue, anger, or, so these are all different symptoms. So heart blood deficiency with spleen chi deficiency. So spleen is digestion. So this person is going to have loose stools, weak muscles, heart blood is deficient. So you can't sleep properly. You have very anxious. You have a lot of dreams. Yeah, so we basically, given the symptoms, we then come at one of these, some kind of diagnosis. And these are the kind of diagnoses that we say. So, maybe somebody would call it bipolar, somebody would call it, in Western medicine, would call it bipolar, maybe call it depression, call it schizophrenia, whatever. But if they fall under these kinds of symptom buckets for us. So and there's been a lot of study of acupuncture for the treatment of mental health. So the VA in particular has studied, there are a lot of studies on the use of PTSD, of acupuncture and the use of PTSD for addictions, for smoking cessation. And actually the VA supports, they have acupuncturists on staff to treat all of these symptoms. Because these are real issues with veterans who come back. They come back with, a lot of post-traumatic stress disorders. They have a lot of addictions. They're smoking a lot. They're addicted to alcohol. So rather than adding on more medication, acupuncture is actually a non-medical approach to treating these kinds of conditions. So so we can treat with body acupuncture, we can treat with ear acupuncture. So, there is a whole system called auriculotherapy where the entire body is represented in the ear. And you can put in needles into the ear in different areas and affect the symptoms that the person is having. Generally speaking, we use this as an adjunct to body acupuncture. So we do acupuncture over the whole on the body, and then we add ear acupuncture in to reinforce the effects on the body of the body. And then also after the treatment is done, we can put in what we call little press balls, little tiny seeds into various areas that you can stick them into the ear, and that will continue the treatment for after the person has left the clinic. You can teach the person acupressure. So, you can show them certain points and, show them how to apply the pressure on those points and treat themselves when they are not in the clinic. In the clinic, it is a little bit more time consuming to do acupressure. So because, say, I'm using 20 needles, putting in 20 needles in a person. Doing acupressure, that takes me about 5 minutes. But acupressure, each point you press and, you're going to wait for, 30 seconds, 1 minute. So it takes a lot of time. So, and it is not as effective as a primary treatment modality as acupuncture is, but it's an excellent adjunct. Then other treatments we use are cupping. I don't know, some of you know what cupping is, I'm sure, but some of you don't. So basically, we take a cup, which has a little nipple on it, and then you can attach it to a suction pump, and you put the cup on the body, and then when you pull it, you create a vacuum, a suction, and that separates out the various layers of the muscle and skin and stuff, and improve circulation in that area. And you can get a relief of pain, coughing, fever, a lot of things like that. And of course, there's herbal medicine. So when you're treating, like I told in this talk I had given to the Asian American Psychiatric Association. So, one of the things that I was pointing out to them is when you want to use acupuncture as a treatment modality for a mental health issue, the relationship between a therapist and the patient is very important when energy is being moved. Sometimes a patient doesn't want to be in a group. No, they don't have issues. They have issues with trust. They don't want to be in a group. They don't want to talk about their symptoms. Some people cannot talk about their symptoms. In those situations, acupuncture is very good because you don't have to necessarily get a full history from them verbally. You can always know what's going on with them from, looking at their tongue, looking at their pulse, and like I said, just the general demeanor of the person. So these are all the things that, and of course, if from a Western medical practitioner perspective, can they have access to a TCM practitioner who can treat their patient? This is just for those guys, but I thought it was an interesting thing to share here as well. So from all of this, this is just a summary for you to get a background of what Chinese medicine is, its complexities, and to just bring a little bit of understanding on how acupuncture can be effective for the symptom relief and actually resolution in some patients with depression, anxiety, insomnia, migraine, etc. So it's a non-verbal intervention. So we don't have to, they talk to us, but if they don't want to tell us the whole story, that's fine because we're going to get pieces of the puzzle from their tongue and their pulse and, everything else. So as a non-verbal intervention, we can put needles into people and, they will relax and the needles work their magic. And it's after a while, they will start, when a person feels relaxed, they're more able to deal with their issues. So everything, the whole attitude towards the problem changes. And so that also helps in, in healing people. It definitely calms, calms patients, reduces anxiety and agitation. So, these people will come in, some people will be like so, restless and anxious and, chatting a lot and being very loud. They put the needles in and then they'll fall asleep. And then at the end of the treatment, they feel very calm and, they feel better. And like I said, you feel better, you make better choices. And it helps, when you're lying quietly for half an hour, it sort of helps develop a meditative core to yourself. You're lying there, you're thinking, you can't move, so you just relax, and it helps calm you down. Is the bottom line of all of this stuff. This is just some of the literature that supports all of this. And then I thought I would, give you a little bit of acupressure. So, a little bit of what is acupressure, and then if there's some common points that I used. So acupressure, same as the acupuncture points on the meridians. You have, instead of putting in a needle, you can do this yourself. This is pressure. And you can use, I have these, you can use any blunt thing, the end of a pencil or the back of a pen. This is something that I have that I use. It has a rounded end on both sides. One is a smaller round, one's a bigger round, and you can press and it doesn't hurt. So you can use any of these things. It can be self-administered. It's not scary. There are no needles. For acupuncture, you need a licensed practitioner. The needles can be scary, etc. So this is, a little bit of an advantage. So some of the symptoms of stress, headaches, neck and shoulder tightness, insomnia, depression, low energy, irritability. And how do you administer the acupressure? Use firm, deep pressure, massage, and stimulate each point. And the points on the body are, one side will be more sensitive than the other. So pick the side that's more sensitive. I'll just show you a few points quickly. Oh my God, we're running out of time. It's almost 11:55. And when you're putting in when you're massaging the acupuncture points, you sit in a comfortable position, close your eyes, just enjoy the whole process. And you can repeat this as often as you like. So common symptom of stress, headaches. So this point is a wonderful point. It's called large intestine 4. And you can see the picture better than you can see what I'll show you. But basically, it is between the thumb and the index finger, and you press this point right here. This is a great point. It's called the command point of the head. And headaches, it's actually even excellent for toothache. So if you have toothache on the right side, you stimulate the left side. But generally speaking, you touch, you press each side and you see which side is more sensitive, and then you can apply pressure on that side. So large intestine 4 is a wonderful point for headaches. Any issue dealing with the head. Another wonderful point for headaches is gallbladder 31. So you stand straight, and where your middle finger touches the side of your thigh, you can press each side and see if one side is more sore than the other, and then you press that side. So gallbladder 31 these are generic points for headache. So if you have any kind of headache, these points will work. Otherwise, there are other points for specific headaches, but you can start with these. Neck and shoulder tightness. These all go together. So, it's basically at the top of the peak of the shoulder here on the trapezius muscle. And I always tell my patients, when you are under a lot of stress, there's a lot of negative thought process that goes through too. So put your hand on your shoulder like this, like you're giving yourself a hug. And while you press this point in the middle here, just give yourself some positive self-talk, It's okay. Give yourself a hug and just press right here, right here, right here, right here. Gallbladder 21, excellent for shoulder tightness, neck and shoulder tightness. Another really good point for neck tension, it's called Luogen, and it's right here. There are 2 points, a triple warmer 3 and Luogen. These are 2 points, and both of these points are excellent for neck and shoulder tightness. You can press these points. For insomnia, there's one very good point. It's behind the ear, where this mastoid bone is, right, this bony part right at the back of the ear. As you can see here, you can press that. It's called amnion. Press both sides. At night, if you can't sleep, just gently massage it, and you will feel sleepy. Or I just wanted to throw in my own picture here. yin tongue is a point right where the bindi is. And that's a great point for relaxing the head, any head issues, again, headaches, relaxation, sleep, and depression, irritability, feeling of being stuck. This excellent point. It's called liver 3. This is one of our top 10 points in acupuncture. It's between the first and the second toes on the foot, and you go down between these two bones, and you will find this point here that's sore, and you can press that. Moves your energy. When you're very tired, the name of this point is Zusanli in Chinese medicine, in Chinese. And I've been told that what this means is once you walked to the extent of you're so exhausted, this will be pressing this point, activating this point will make you walk 3 li more. Li is a distance measure in Chinese medicine, in Chinese. You can walk. So this is on the outer side of the leg, just 3 finger widths down from the knee. On this point right here. So you can put your hand like this, like they've shown in the picture here. Find the spot. So this 4 fingers is going to give you the distance here, and then 1 finger width off the edge of this bone. This is stomach 36. Amazing point. For digestion, for tiredness, wonderful point. So these are some commonly used points. And I hope I'm going to finish my talk now. Conclusion. I hope I was able to give you a basic understanding of Chinese medicine principles and its components, a basic use of its understanding of its use in mental disorders. And then we talked about a few points. And I just want to reiterate again here, if you have an issue, find a licensed acupuncturist. This is a licensed medical profession. So there are plenty of us around. And you can find a licensed practitioner here. The practitioner directory is right there. So look around for you. And my advice to you is, look for reviews. Generally, happy patients leave reviews for you. Unhappy patients also leave reviews. So you can judge by, how you feel resonate with that person, with that practitioner when you pick a practitioner. Yeah, that's it. My practice is in Lexington, and anyone wants to call me, visit me, you're most welcome.
Thank you so much.
Thank you.
Let